My name is Pablo Racinos. In this short movie, we will be reviewing the highlights of endoscopic third ventriculostomy for the treatment of hydrocephalus. After placing the endoscope through the peel-away sheath, the lateral ventricle is entered. On the right side of the screen, the thalamostriate vein is seen just lateral to the choroid plexus. The anterior septal vein is located just medial to it. The endoscope is then passed through the foramen of Monroe without hitting these structures to avoid causing bleeding. Familiarity with the anatomy of the floor of the third ventricle is critical to avoid potentially devastating complications. If we follow the structures from anterior to posterior, we first see the optic chiasm at the top of the screen. Just under it, the red structure is the infundibulum, followed by the floor of the third ventricle. The paired mammillary bodies are seen posteriorly, and the shadow in between them is the basilar artery. The location of the basilar artery can be variable, so it is important to study its relationship to the floor of the third ventricle on preoperative imaging. In order to perforate the third ventricular floor, a variety of instruments can be used. We prefer a blunt probe, or Bugbee wire, to avoid inadvertent damage to the basilar artery. Gentle pressure is applied using a twisting motion to create the perforation. Once the perforation is made, we pass a 3 French Fogarty catheter into the prepontine cistern. In order to enlarge the opening, the balloon is opened within the stoma and pulled through. Notice that the balloon is not being inflated completely to avoid hypothalamic injury and causing undesired bleeding. Once the stoma is sufficiently large, the prepontine cistern is then inspected. The basilar artery is seen just inferior and posterior to the opening that we have just created. If significant arachnoid bands are seen, they can be dissected to further facilitate flow of CSF. We do not recommend aggressive exploration, however, given the risk of damaging arterial perforators of the brainstem. To enlarge the stoma further, the Fogarty balloon is inflated and passed by repeating the previous steps. Although the steps to enlarge the stoma may need to be repeated, we prefer this technique to sharp dissection or cauterization to avoid damage to adjacent anatomy. The change in pulsations of the floor of the third ventricle indicates that CSF is now flowing freely from the third ventricle to the prepontine cistern and on to the cortical subarachnoid space. After the fenestration has been made, the ventricular system is inspected to ensure that there are no active sites of bleeding prior to completing the procedure.